Hi, everybody. My name is Darlene Thompson. I'm the Program Manager for Career Development here at Mary Washington Healthcare. With me today is Katie Lancey, who is the Clinical Student Coordinator. And our special guests today are the representatives from Rehab Counseling. Okay, what we'll do first today, before I have everyone introduce themselves, I'm going to take just a couple of minutes to give you some tips. One of the things that I would like to share is that we do have two Kahoot games. We had a pre-game that hopefully you all participated in, and we'll also have a post-game. So please make sure that you stay on with us and you can participate in that post Kahoot game, and for that particular game, you can win some incredible prizes. So please make sure that you participate in that. The other thing that I just would like to let you know is that we will have a live student Q&A towards the end of the program. So at any point that you have a question, please go ahead and submit your question. If you'll look for the question mark towards the right-hand side of your screen, you can go ahead and submit your question. And when we get to that point, we will be more than happy to address your question with our experts today. Okay, so with that, I'd like to go ahead and have the panelists please introduce themselves. I'll start with Rachel.
Hello, I'm Rachel Frakes. I'm a speech language pathologist. I went to the University of Virginia for my graduate degree, and I've been working here at Mary Washington Hospital for 13 years.
Okay. All right, thank you. Christine?
Hi, I'm Christine. I'm an occupational therapist. I went to Virginia Commonwealth University for both my master's and doctoral program, and I've been here for 4 years almost at Mary Washington.
All right, appreciate it. Okay, Erin?
Hi, I'm Erin John. I'm a physical therapist. I've been at Mary Washington for 4 years. And I also got my doctorate of physical therapy from Virginia Commonwealth University.
Okay. And Kim?
Hi, my name is Kim. I'm a physical therapist. I have been at Mary Washington for the past 3 years. I've been a physical therapist for over 25 years. And I graduated from the University of Florida and made my way up to Virginia.
Okay. All right. And Allison, please.
Hi, my name is Allison. I'm an OT, and I've been at Mary Washington for about 1.5 years. I also went to Virginia Commonwealth University, and I've been an OT for about 9 years.
All right. Thank you so much, team. I'm going to start today by making sure that all of our participants understand a little bit about each of your areas. So I'd like to go ahead and pick a few of you to share some information and give the students an overview of your areas. I think I'd like to begin by asking, please, tell me about the careers in rehabilitation. And Erin, would you address that for me, please?
Sure, thanks, Darlene. Rehab services can include all of the areas that we as a group represent. So that's occupational therapists, and there is another degree called an occupational therapy assistant. There's physical therapy and a physical therapy assistant, speech and language pathologist, and also most departments and offices have a rehab technician or a rehab aide. And we all do something a little different, but our goal is always to help patients improve the function and the quality of their life. We're just different in what aspects we focus on, and we'll touch on that a little bit more this evening.
Okay. I'm sure that our students that are on here today would love to know about the patient population. So who do you work with? Can you give me a little insight towards that, Christine?
Sure. We work with various patient populations here in the hospital. Most of us are not working with the pediatric population or kids or babies. However, we do have some of our therapists who do. However, a lot of our patients are across the lifespan, and they may come in for cardiac issues or orthopedic issues, such as fractures or something related to a fall or needing a surgery. And a lot of our patients can have neurologic disorders. And so that can be, sometimes these events have been longstanding, or sometimes it has, anytime they've come into the hospital is because something has changed at this moment. However, you can also work in a lot of different settings. And so we'll kind of go into the different settings later on, but here in the hospital, these are kind of the patients that you're seeing that we're working with right now.
Okay. And actually, we can go into some of the work settings now. I'm curious, then tell us, where do the therapists actually work at? What are the work settings? Allison, would you address that for us?
Sure. PTs and OTs and speech therapists can work in a lot of different settings, kind of anywhere that you would go for medical care. So we can work in a hospital like we do here, or an outpatient clinic like we do here. In the hospital, people are staying overnight. They're staying for a longer kind of time to figure out what's going on with them. You can come to outpatient, where you're going like to kind of like to a doctor's appointment, and get therapy when you're still staying at home, but going to get therapy somewhere. We also work at rehab facilities and nursing homes, and that's where somebody would go to kind of spend a couple weeks or maybe potentially a couple months to get better and get rehab to be able to go back home. There's also therapy and home health, so where therapists can go visit patients at home if they're not able to leave their house. So you get to travel around and go to in the home. We can work in schools with children of any age, like high school or even elementary school, preschools, all kinds of things like that. There's also therapists that work on sports teams. Like you always hear about professional sports teams having their own therapists there, and then private companies. So sometimes therapists like to start their own company and kind of come up with different ways of providing therapy to people.
Okay, thank you.
Mm-hmm.
So as a high school student, if they are interested in getting into one of the therapies, one of your areas, what are some of the high school opportunities that they should consider? Christine, will you address that for us?
Sure. So you can do observation hours, and there are a lot of different settings that you could get involved with. And I know some things may be a little limited right now, just with the current healthcare environment with COVID. So sometimes it's not as easy at this moment. However, always reach out to any place that you're interested in and see what their current policies are, and see if you are able to have any opportunities to shadow. And then you can also be working in different clinics, and you can take jobs, and you can always get involved in different clubs that are, you know, looking toward careers in healthcare, and sometimes they can connect you up with professionals in your area, and just that can be an opportunity to talk one-on-one or develop a connection and understand a little bit the ins and outs of any program that you're interested in. And you can consider taking higher level science classes and starting to get into that. But if you don't get into that in high school, that doesn't mean you still can't look into that in college or even beyond. Not necessarily all of us, you know, knew exactly what we were going to do in high school, but it's great if you are interested, and you can start expanding your horizons and start diving in high school and seeing if any of these things are interesting to you.
Okay, thanks so much, Christine. Now, I'm sure that all of our participants are curious about the salaries in terms of the rehabilitation careers. Kim, can you give us some information then? What do the therapists make?
Sure. So therapies, there's a pretty good range. For physical therapists, they can start out making $68,000 and go all the way up to $116,000 after many years of practice. Physical therapy assistants, because there's less schooling involved and there's a little less responsibility, they'll make a little bit less, and anywhere between $47,000 to $68,000. Our occupational therapists make in between $75,000 and $116,000, depending upon how many years they've been working. And certified occupational therapists are very similar to the physical therapists, where they make between $47,000 and $71,000. Our speech and language pathologists will round us out with $71,000 to $106,000. And then, of course, our rehab aid, which does not require a degree, is between $27,000 and $38,000. For the higher end salaries for most of these therapy positions, experience and what other kind of specialties you may have will give you that extra boost in your salary. So once you get your degree, it's not something that is the end. Your degree is not the end. Sometimes, or all the time, you have to take more classes afterwards. And many of our therapists will become certified in different areas that'll give them a higher salary.
Okay, thank you. I think to give our students an opportunity to learn a little bit more about what each of the areas is about, I think it would be great to show a video. Why don't we start with a physical therapy video to give our students an idea of what this actually looks like. So if we could, let's go ahead and take a quick peek at physical therapy, please.
Hi, my name is Kim. I'm a physical therapist. Here in Outpatient, we work in many different areas of mobility. One of the ways we may start a patient off is getting them in and out of bed. And then we may move them to a wheelchair so that they can learn how to progress and propel themselves. This is a good way for mobility, but it's not the best way. So we're going to work on a little bit of walking. So Erin here is going to learn how to stand up from a sitting position. So Erin, I want you to push yourself up from the wheelchair, okay? So Erin's going to go from a sitting to a standing position and then grab a hold of the bars. Here in the bars, we may work on balance and leg strength so that she can then progress to walking. So if Erin has an injury on her right leg, we're going to work on her lifting her leg and picking her leg up and stepping forward and standing on that leg and keeping her balance all the way through. And as she learns and she gets stronger, we're going to progress her all the way down to the cane. Erin, I want you to use this cane. That cane goes with that left hand, so you're going to step with the right foot and step. Good, Miss Erin. And as Erin moves from a cane, a single point cane, to walking by herself, we can then work on her getting into more functional activities around the home. Perhaps she is a tennis player who broke her knee. We would work then on getting her knee range of motion much stronger, much better, so that she can return back to her sports.
Okay, well, that's great. That will give everyone a chance to really see a little bit more about physical therapy. So Kim and Erin, I'm going to address the first set of questions to you. So my experts, I'm going to ask each of you a question about physical therapy to look a little bit more about what we've just seen. So Erin, what are some of the specialty areas as it relates to physical therapy?
Physical therapists can be fairly general practitioners depending on the setting that they work in. They'll be specialized to their setting, but there are specialty areas that require a little bit more specific training. And there's advanced certifications in some of the areas on the slide right now. There's a geriatric certification where your focus is on the elderly and how to help that specific population. There's specialties for orthopedic patients who have fractures, or that is sometimes more focused towards sports medicine. There's neurological specialties for patients with strokes or seizures or a brain injury. Specialties in cardiovascular and pulmonary areas for patients with heart and lung problems. There are definitely specialty advanced certifications for pediatrics. And some therapists even specialize more specifically into helping with different kinds of adaptive technology and equipment that patients may need and developing that. There are specialists for lymphedema or more sports medicine and geared toward not necessarily rehabbing a patient who had an injury, but you can also specialize in improving sports performance. And those are the therapists that are going to work more with athletes and trying to improve the function that they have in their game by the strength in their arm. Clearly on the slide, there's a lot of different things you can do in physical therapy and a lot of different ways you can specialize something that you love with also being able to help people get better at whatever it is they want to be able to, however they want to move better.
Can I add something? But I wanted to reiterate that what Erin said in the beginning is that most physical therapists don't function in a specific area. If I am a pediatric physical therapist, I may be working with patients who have orthopedic and neurological conditions. If I'm working in a clinic like I do right now, I see people with shoulder pain, back pain, strokes. They've had amputations, so I'm working with their orthotics or their prosthetics. So the specialty is not necessarily something you would do. That would be the only thing you would do. Most therapists are generalists and they know a little bit about a lot of things. And then some therapists will decide to specialize.
I agree, Kim. And even in somewhere like acute care, like we all work at Mary Washington, on the acute care side, we see patients with a lot of those different issues and problems. We help them all, and we are generalists even in the acute setting of patients who are critically ill from a medical reason. You know, we treat them all, whoever needs care here.
Yes, yes.
Okay. So Kim, if I wanted to become a physical therapist, what would I need to do?
Well, first of all, you have to graduate nowadays. You have to graduate with a 4-year degree. You have to have a bachelor's. On the screen, they show many common bachelor's degrees, but to be quite honest with you, if you graduate with any degree, as long as you have the core classes that are required, so they're called prerequisites, as long as you have the prerequisites, you could graduate with a neuroscience degree and still get into a physical therapy program. You see on the screen, there's a lot of pre-PT curriculums. It's not necessarily required that you go to a school that has a pre-PT program. There are a few in the state of Virginia, but not all of them have it. So any degree that's a 4-year degree plus the sciences that you would need to support it. And typically those are going to be, you're going to need biology, you're going to need physics, you're going to need math, and then anatomy and physiology. And so those are a lot of the requirements. But once again, you can have any of the degrees on the screen, or you can have some other types of degrees.
Okay, all right. What does the physical therapist assistant, what does that person do, Erin?
The physical therapist assistant, the difference is really the amount of schooling we get from a physical therapist to a PTA, the physical therapist assistant, and the responsibilities that we have for our patients. So a PTA degree is an associate's degree. It's about 1.5 years of school after high school. And then a physical therapist is going to have that undergraduate degree that Kim was talking about, and then a 3.5 year doctorate program after that. And so the difference is the responsibilities that we have to the patient. The physical therapist can do the initial assessment and treat and create the plan of care for what that patient needs. And then we partner with our physical therapy assistants who help carry out the treatments that the PT has decided the patient needs. And there is some, I say it's a partnership because PTAs also have knowledge and skills, and they're a licensed professional. So there's a lot of communication in that. My suggestion to the PTA, my recommendation is that a patient needs exercises to strengthen their legs, but the PTA can make decisions about how many exercises and how to progress the patient forward. We work as a team to get patients better.
Okay, all right, thank you so much. Okay, so what we are going to do now, let's get a chance to talk and find out a little bit more about occupational therapy. So we'll start with the video. Curious to see what an occupational therapist actually does. So let's take a peek and see what they do, and then I'll start to work with the team here with us today and ask them questions about what it means to be an occupational therapist.
Hi, my name's Christine. I'm an occupational therapist. And so today we're going to be working with the patient and taking a look at how occupational therapy can impact our patients in living their daily lives. So that allows us to do different activities, and sometimes those activities include working in the kitchen and helping to prepare your meals or to be able to feed yourself. So with my patient, I may do some activities that would involve her using her arm that had been affected after an accident or injury or some other medical condition, and helping to work on reaching exercises where she can use her fingers and help to do exercises, and also work on different grasp patterns so she could pick things up, such as reaching for a utensil. And sometimes we also think about different items that can help make things easier, like bigger utensils or additional placement items that can help to keep items from slipping. So with my patient, after we warm up and do some different exercises, what we may look to do is to get up, and I can make sure that she's going to be safe navigating in the kitchen. So let's go get a plate out of the cabinet, and then we can work on further reaching tasks with her shoulder and making sure she's going to be safe when she would go back home. So can you reach for that plate there, and let's go and prepare ourselves a snack. Now when she sits down, we can also think about other adaptations such as plate guards, which can help her be able to make sure her food wouldn't come off, or even just different weights with utensils. Now this is all something that may be impacted in an outpatient setting. Now occupational therapy as well in an acute care setting can also look at how we are able to get down to our basics, such as bathing, dressing ourselves, getting on and off the toilet, and also being safe getting in and out of bed and moving around our environment. So these are just some of the ways that occupational therapy is able to help our patients live their lives more independently and safely so they can look to return home.
It's good to see the video so we can better understand what an occupational therapist does. So Allison and Christine, I have a series of similar questions for you as well, so we can get a better understanding of what it means to be an occupational therapist. Let's start with the specialty opportunities. What do they look like, Allison?
Sure, there's a lot of different opportunities and areas that OTs can work in. We do kind of like what we're describing in the video. We can work with people who've had specific like hand injuries. You can get a hand specialty certification. OTs can work on things like driving and being able to get back to driving and using a car after you've had an injury that might affect an arm or your vision or some type of thing to kind of adapt for any type of injury or type of thing that has happened to you. We also can work with pediatrics, working with kids in school systems, or like working in an outpatient clinic on getting back to doing the things that kids would need to do, like be able to write or play and use their hands to do things like that. OTs can also be a big area for us, like you saw in the video, is assistive technology and adaptive equipment. That's kind of similar to what's on the picture on the screen. That's a therapist teaching a patient to be able to put their socks on. They might not be able to bend over to put their socks on, but they can use equipment to be able to do that. And we have all different kinds of fun tools to show people to be able to be more independent and do the things that they need to do without assistance. Some of the other things that are listed on here, you can have a stroke certification. So people who like to work with people who have had strokes kind of learn different types of strategies and different types of things to help them get back to living their life. There's different other types of equipment like the Sabo that's listed on there. That's a type of equipment that we can use. We can also get certified in seating and mobility specialties. So if somebody is having to spend the majority of their time in like a wheelchair, we can kind of help with determining what's the best type of wheelchair setup for them and what type of adaptations they might need on there, based on how much function they do have. So if you aren't able to use your hand and all the different grips and grasps that you normally would be able to, try and help figure out different ways to adapt a wheelchair so that you can use it. And there's other types of specialties on there. We can work in school systems and working with people who have had vision problems, and brain injuries. There's an endless list of places that we can go and the things that we can do to help our patients out.
Okay, thank you so much. So Christine, if I wanted to become an occupational therapist, what would I need to do?
Well, at this point in time, you would need to go to undergraduate university and have a 4-year degree. And so there are a couple majors listed here that you could consider for OT. However, as Kim discussed, you can have any major and apply for an OT graduate program. There are currently some programs that are still a master's degree in occupational therapy, and there are some programs that are a clinical doctorate in occupational therapy. And a lot of those programs are usually about 1 to 2 semesters difference. It just depends on the schools. Many schools are changing over, in the process of changing over to a clinical doctorate. However, you can still practice with a master's degree at this point in time, but you can be any major. I personally was a theater major at my university, so you do not have to be biology, sociology. You then just take those prerequisite classes. So as Kim discussed, it's very similar for occupational therapy. You need to take like anatomy and physiology for a couple semesters. You need to take some higher level mathematics courses, some courses that go across the lifespan. And so it's a pretty broad spectrum curriculum, but just making sure that you do have some of the heavier science classes in, but you can have any undergraduate degree to then progress to another, usually 2.5 up to about 3.5 years of for your graduate education. And OT is considered a clinical doctorate. However, you can also look to do both with PT and OT. You can do a PhD in something like a health sciences, and then you could do a dissertation relating to physical therapy or occupational therapy as well.
I'd like to add, Darlene, one thing we
Sure.
forgot for PT, but we all are licensed medical professionals, so you do also have to pass a board exam at the end of your schooling.
Okay, very important, absolutely. Okay, want to make sure, does anyone else have anything to add?
And then, as Kim talked about, we have to keep taking classes, but part of that also goes towards continuing to renew our licenses. So we don't just pass once and then never think about making sure we're keeping up to date. Those things all count because we have to show that we are keeping up to date with current practice and also looking to just be involved in patient care and be active and in good standing. So, we do have Virginia, yeah, but just making sure we're up to date in various ways. Sorry, Kim, yeah.
Okay. Thank you. So I'm curious, and I'll address this question to you, Allison. So we've been talking about an occupational therapist, but I understand, of course, there's a certified occupational therapist assistant, and I'm curious, so what does that person do?
Yeah, it's very similar to the difference that Erin was describing earlier between a physical therapist and a physical therapist assistant. It's basically the difference is the amount of education that you have to get. It's like usually a 1.5 to 2 year program versus the master's or doctorate level program. But we work together. It's definitely a partnership. An occupational therapist assistant works with and under an occupational therapist. And the difference is that the occupational therapist will do an evaluation and kind of determine what are the main areas of things that we need to work on with the patient. And then the assistant can come and do the treatment session. So they can kind of carry out that plan and kind of decide, these are the activities that we can do to help them meet the goals that they set on the evaluation. So kind of working alongside the OT to kind of progress that patient and get them back as independent as possible.
Okay. So if by chance, I don't necessarily want to be an occupational therapist, but I'd like to become a certified occupational therapist assistant. So what would I need to do to get that certification? What would I need to do then? Would you help me with that, Christine?
Sure. You still have to go through the application process just like you would to any program, which is kind of sometimes having taken standardized tests. Sometimes you need to have grades from a prerequisite. It just depends on the particular program. But then you can go ahead for we say a CODA, a certified OT assistant. So for a CODA program, you need to have a high school degree, and then it depends on the program as to any further stipulations. Sometimes they want you to have taken several classes before you started, again, that kind of anatomy and physiology. It really is program dependent. So any program that you become interested in when you finish high school, reach out to the program, start making contact with anyone who's there at the university or community college, whatever the program is through, and start finding out what you can do to start preparing, because you don't want to just think that sometimes I think people think, well, I can just reach out and things can happen very quickly. And for a lot of us, it maybe took, sometimes even a year of planning, just getting things in order that we needed to do in terms of shadowing hours or taking any additional course that you may need, getting references. I mean, it may take a while to get yourself stacked up to be ready to be in a program. So just check in with your program that you're interested in and see what their stipulations are.
Okay, excellent advice. Okay, so we have learned about physical therapy. We've learned about occupational therapy. Now I'm really curious about speech language pathology. And Rachel, I'll be really addressing these questions to you, but first let's start out with the video. I'd like to see a little bit more about what they do, and then I'll go ahead and start asking some questions.
Hi, I'm Erin. I'd like to tell you a little bit about speech and language pathologists today, also known as speech therapists. These therapists get training to help people live their life and get back to their normal activities. This includes things like having good breathing patterns, also being able to swallow, and being able to eat foods of different consistencies as they recover from something like a stroke. They help patients learn how to talk again or talk better, and if patients can't talk, they help them communicate by using things like a communication board, so a patient could point to items that they need in the home even if they couldn't say it out loud. Lastly, speech therapists can help patients who have trouble thinking or with memory after a brain injury, or patients with dementia, to be able to get back home safely or remember what items are on their shopping list to help them function in the world.
Okay, that was helpful, very helpful. So Rachel, I'm going to address quite a few questions to you, but they're similar. So what are the specialty areas as it pertains to speech language pathology?
So we're your specialists in communication. Here in the hospital, we work a lot with swallowing, but just like PT and OT, we have a broad description of the different areas that you can go. So you have a lot of choices. You can work with children. Most of the people who are working with children are in the school system or in early intervention programs. We spend time in the neonatal intensive care unit with preterm infants, helping them develop the skills they need to eat and grow and eventually communicate. We also work with people on motor speech disorders, which would be people that have strokes and then have difficulty communicating. We can spend a lot of time with people who have brain injuries, developing ways to communicate and live their daily lives. Head and neck cancer is a big area that we spend a lot of time for people that undergo radiation. They need help making sure that they can communicate and that they can eat and drink throughout their cancer treatment. Accent reduction, you see speech pathologists working with the general population that wants to reduce their accent so they can be better understood, but then also with the more glamorous side is the movie stars that want to develop an accent for a role that they might be playing in a movie. Same thing with professional singers. We work with them to help with breast support to support their singing. People that have undergone gender reassignment surgeries will need to change their voice as well, and that is something that we work on. And then fluency and fluency disorders, the less fancy word for that is people that stutter. And so we work on that as well. And we are all over the place in the hospitals, and nursing facilities and homes, just like PT and OT.
Okay, thank you for that. So if I were interested in becoming a speech language pathologist, what would I need to do?
So you start with a regular 4-year undergraduate degree. You can major in anything that you like. My undergraduate degree is in biochemistry, but my best friend that went through school with me majored in linguistics. So you can do whatever degree you feel drawn to. You just have to make sure that you get your health-related classes in there, your biology and your biochemistry. There's also a lot of linguistics and psychology that you would have to take before. And then the graduate program is a master's. It's a 2.5-year program, and then it's followed by a 9-month fellowship. So you get 9 months where you work in conjunction with another speech pathologist very closely to make sure that you've developed all the skills that you need to be effective. Like PT and OT, there is that wonderful board certification that you have to pass on the state level to maintain your license, because we are licensed medical professionals and we have to keep up with all that continuing education as well. And there are lots of opportunities to specialize in a lot of different areas that will then require more continuing education as you move along in your career.
So can I say one thing? I wanted to mention to everybody that if you're interested in any of the 3 careers, your undergraduate degree, the grades you get in your undergraduate degree are very important. These programs are a little bit difficult to get in, but I do want to say that if you don't get in the first time, please try again. Many programs are between 30 and 50 people each year, so they're kind of small programs. My daughter's in a speech therapy program, and her program is only 50 people big. So she took a year off, got a lot of, like Rachel was saying, graduate programs, classes that she didn't get in her undergraduate degree in order to get in. So it's worth it to try multiple times if you can't get in the first time.
And that actually, thank you, Kim, that actually ties into my next question, Rachel. I was going to ask then, specifically for the speech language pathology area, what are some of the colleges in Virginia that might have that program, just in case some of our viewers are interested?
Sure. So I went to the University of Virginia, so I'm partial to their program. The JMU also has a program. George Washington University, Gallaudet, Old Dominion University, and Longwood. They all have programs. They have developed over the past few years a more virtual online track that you can choose. If you are interested in working with children in a school setting, that virtual track might be something that you could look into. if you were more interested in working in the medical field, say in a hospital with patients that have difficulty swallowing and upper airway disorders, then the more traditional programs where you attend class on campus tend to be a better option to make sure that you get the appropriate experience.
I appreciate that. Rachel, I'm going to stick with you. I'd like to learn a little bit more and share this with our viewers. Tell us about a rehabilitation technician. Can you tell us, please, what is a rehabilitation tech and what do you need to do to become a rehabilitation technician as well?
Sure. So our rehab techs make all of our lives easier, PT, OT, and speech. They help us be more efficient, more organized, and more effective in everything that we do. They help the therapist and the therapy assistants. They gather materials and supplies. They will actually help during the sessions with moving patients or doing exercises. They will communicate with families or in the hospital with the nursing staff. They just generally are there to be helpful in any way that they can. There is not actually any degree that they have at this point. A lot of their training comes from being on the job and learning as they go. A background in like exercise physiology or education would be helpful, but you certainly don't have to have it. You can learn everything that you need to know after you get a job as a rehab tech.
And Darlene, I'll add to that, a lot
Please.
of people who become therapists in any of our respective disciplines use the rehab tech aid position as almost a stepping stone to help them learn more about therapy, and they might use that to get hours and help them decide kind of which discipline they are more interested in, and just learn a little bit more about the field before they commit to that wonderful chunk of schooling and education that we all have.
Okay. Okay. Does anyone else have anything else to add? Okay. Okay. So,
Well, I guess if
okay.
I was going to say there are a
Good.
few OT schools here in Virginia if you're looking. There had been 6, but in terms of things you want to consider, there can also be a different varying amounts of semesters sometimes, and they can also be private versus public institutions, just like your 4-year schools, and that also goes for CODA programs as well, and even the PTA programs. Sometimes they're through public universities, which is going to be a much different cost than going through a private school. However, sometimes the time length is different. So you always want to take a look at what the whole picture is going to be in terms of your financial investment in terms of your school as well. The OT schools in Virginia for an OT currently are James Madison as well, Radford University and Virginia Commonwealth are the public institutions. ODU in the future will be, in the next several years, they will have a program. However, it's not up and running yet. And then there is also the private schools, which have Mary Baldwin as an option. Emory and Henry is a new program, newer in the last like 2 years or so. And then Shenandoah University has 2 branches as well. And their program, as Rachel was kind of talking about, is a hybrid program, which is more geared toward online. And so you just really, anything I could say about if you're interested with a program is all programs that I was looking into had opportunity sessions for you to come in and meet with faculty, and they would give you a presentation and say stuff about their program, what they're looking for, and what the focus of their program is. And go and see if it sounds like what's interested to you and what they're going to look at for your degree requirements, because sometimes you get additional points by doing X number of clinical hours. And if you do 100 versus 60, they'll give you an extra point on your application. So go in and try to make some connections at the places you're interested in.
Okay. Okay. Would anyone else like to add before we go to our Q&A with our students? Anybody?
So
Kim?
One thing that I think all of us kind of alluded to, but I wanted everybody to know, is that for each of these disciplines, PT, OT, and speech, when you're going through school, you actually go to the clinic and you're working under a therapist, whether it's a speech therapist, a PT, or an OT, depending on your degree, and you actually go and spend 8 weeks to 12 weeks at a given practice to learn how to become a therapist. And that's towards the end. And sometimes for some of the therapies, it's in the middle, right, ladies, of your therapy. So I did want to put that out there, that there's a large clinical aspect to doing your degree, your PT, OT, or speech degree.
Okay. So what we're going to do is we're going to transition a little bit. I'm positive that our viewers will have some questions for the team, and Katie is going to actually manage the chat, and she's going to address each of you with some questions. So she's pulling up the chat and looking at that right now. So Katie, whenever you're ready, there you are. You can go ahead, and then as I said, we'll go ahead and see how many questions our participants have for us today.
Oh, we got a handful. Okay. So
good. We're ready.
Our first one, and I'm sorry guys, I got 2 screens, so I'm going to be looking off to the side for the longer ones. But a quick first one is, when you talked about applying to multiple, trying multiple times to get in, did you apply to multiple schools at the same time, or did you continually apply multiple years, I guess I should say?
Does anybody want to take that? Because I've been out of school for a while.
I know of some people who applied multiple years because they only wanted, Allison and I, both on the OT side, both went to VCU, and I knew some people who applied and did 4 years in a row, even trying to get into that program. Personally, I applied to several schools, and I was going to go that year to whoever I chose that year. But there are different options. I don't know what anyone else did, but.
I also applied to multiple schools, but because they're all graduate programs, I think as you go through college, and you've been through the undergraduate program, if you're looking at PT, OT, or speech and not the assistant level, it's a similar process where you're applying to schools and seeing which ones you get into. So certainly having multiple options that all work for your life and where you want to be, or what focus the school has, is really helpful. But like I said, similar to undergrad, take a tour, go visit them, meet a professor and some students, and see not all programs are the same. They have different focuses and different pros and cons to help you kind of make that choice, so you don't apply to 100 schools at one time. Have that list of 4 or 5 as your top choices.
Great, thanks. Oh, yeah, go ahead.
Sorry. One thing that it's also useful to look at is each one of those schools should be able to tell you their pass rate for the state or examination. It made me a lot more comfortable knowing I was going to a school that had a really high pass rate for that exam, so that I'd be more confident going into it.
Good point.
Good point.
And if they're not advertising that, ask that, because that is good to know. And they do keep those statistics. So.
Okay. I've got 2 speech therapy ones.
Okay.
The first is, do they offer doctorate programs in speech therapy? And the second follow-up is, how many hours of observation do you need to apply for a speech therapy graduate program?
Okay. They do offer doctorate programs in speech pathology. Right now, they tend to be a more traditional PhD program rather than a clinical doctorate, although we do have a few popping up now for the clinical doctorate, similar to PT and OT, but for the majority of programs, you'd be looking at finishing a master's degree and then starting a PhD program if that is what you were interested in doing. There are a lot of PhD programs out there. They're more research-based rather than clinical. currently. I think you'll see a change in that in the future, but right now it is mostly a regular PhD. And then as far as the number of hours that you would need, each school is going to be different. So you'd want to make sure that you're getting the hours that they are requiring in order to apply. And it's something that you would probably want to start early with, because it does tend to be a fair number of hours. It's not generally like 20, it's more like 100 plus. So you're going to take some time to find a place and get that experience. And some places may want you to get that experience across a lot of different settings too. So it does take some legwork to find places that are willing to have you come shadow and get those hours.
And on that note, since COVID came in, they did implement, some of the schools implemented that you could actually do some of these online. And they, because my daughter went into school and had a difficult time finding, because of COVID, finding her observations. So they did put up a, you could pay to watch videotapes of speech and language therapists. So that was something new this year. I don't know if they did it for the other services, to be honest with you, PT and OT.
I know they did it for OT, but I don't know about PT.
Good.
So another question is if you can help distinguish, the question itself was, can you be an OT and a PT at the same time? But if you guys, Erin, if you can take a hold of this one, help distinguish the two aspects and the way each perspective works.
Absolutely, I will take this question. At Mary Washington, we currently have an associate that works with us who is in fact an OT and a PT. She is both. That does mean she went to 2 separate graduate programs and passed 2 separate sets of boards. She did all the schooling. So she is a very knowledgeable therapist, and she practices as both, not at the same moment. She may see the same patient twice in a day, once as a PT and once as an OT. And the difference is really based on what we're looking at and what our goals are for the patient. So when I have patients and they're saying, what's the difference between you and Allison, who's in the room with me, maybe we're working together that day. PT, my job is really to help you get where you're going. Can you get to the bathroom? Can you get down the street to your car or to the grocery store? If you're an athlete, can you get to, excelling at your sport rather than just being in it? And OT for me helps you when you get there. So, we got you to the bathroom, but do you know how to pull your pants up after you go? Do you know how to get in and out of your cabinets, or do your hands work to fix your breakfast? Their job is to really help you do what you want to do in your life. And maybe Christine or Allison, you'd like to elaborate on my definition there, but it's really kind of, all of us want to help patients move and live to the best of their ability. It's just kind of what our main focus and our goals are is the difference.
I think it was well said. PTs help you get where you're going, and then when you get there, OTs will help you do what you need to do. So it's all about function, and our jobs, all of us at the end of the day, is for people to get back to their lives and be as independent as possible in what they're doing, and do what they want to do when they are going throughout their lives.
Okay. Ooh, I was not expecting this one. And this is a group question because it could apply to anybody. Have any of you worked with sports psychologists?
So I've not worked with a sports psychologist, but I've worked with clinical psychologists. So I've worked hand in hand on a brain injury unit with clinical psychologists, but never worked with sports psychologists.
Okay, and then, we have somebody who it looks like did their observation hours with us, and they're trying to pick between going PTA and DPT. And one of their biggest concerns is, how much time do you actually spend with the patient when you're a DPT or a lot of those tasks delegated? And do you spend a ton of time doing paperwork, or is it just like a small section of the day?
Kim, do you want this or you want me to take it?
Sure, I will take it. So typically a PT and a PTA spend the same amount of time with their patients. We can spend, and I work in outpatient, and I can spend 45 minutes to an hour and a half with a patient. I worked in acute care settings or nursing home settings, and we can spend, in those settings, you can spend an hour, you can spend 30 minutes. It really depends on what the patient, but the PTA and the PT do not necessarily spend less time. They spend the same amount of time. The paperwork aspect, there's always paperwork in healthcare, unfortunately, and the PTs do more of the paperwork. We all, both PTs and PTAs or CODAs and OTs, we have to do daily notes, but the PTs and the OTs are responsible for doing the evaluations and more, for the most part, progress notes and letters to the doctor. But we spend the same amount of time with our patients, at least in the practices I've been at, ladies.
Agree.
Yeah, it was same for OT, exact same. The assistants and the therapists spend the same physical amount of time with the patients, but the documentation and the paperwork is a little more intense for the therapists versus the assistants.
I mean, if you want to go back to what's the difference between the programs, it is going to cost you more to go and get your DPT versus to get your PTA. However, you are going to get paid more when you get out of school. PT versus DPT versus PTA. So.
And you do have a few more options in where you practice and the settings based on your state practice acts as a PT, as a DPT versus a PTA. There are some things, because they're so assessment heavy, PTAs aren't, it's not in their scope of practice to treat infants in the NICU. Just because of how much care and assessment those babies need in that critical state. And there are, I will say, Katie, a handful, not many, of transitional programs in our country where you could go from a PTA to be in a program to become a DPT. It is a slim number, but there are a few. If that was something you're interested in, I believe there are more programs to go from CODA to OT. Is that correct, or did I make that up?
There are. It's not many, though.
It's not many.
Yeah.
Not many.
However, when I went to school, a long time ago, I did have a number of PTAs in my PT program. Mm-hmm. So they had done their year and a half of undergraduate degree. And then they had to get those extra prerequisites in order to become a PT, and then they started the PT program. So sometimes you'll see that too, but that's maybe that's a commitment.
Yeah. Okay. Oh, we got a fun. Well, all of these are fun questions, but. We have I guess I should say a personal question. The audience, Kim, is wondering what program your daughter is in.
Oh, my daughter?
Yeah.
My daughter is going to school in Boston. She's going to her speech therapy school at the Massachusetts General Institute of Health. So that's up in Boston. She did apply to a large number of schools, and mostly because she was fearful she wouldn't get in. She took a year off, and she was pleasantly surprised that she got into about 75% of the schools that she applied to. And nothing against she graduated, her undergraduate degree is from the university, is from CNU. So she was very happy to get into all the programs she got into. So the schools here are good.
That's awesome. And then I'm going to do this for Christine. They're wondering, and just from your experience, how open is Mary Washington to new grad CODA hiring?
Well, you should always apply. I think everyone has to be a new graduate somewhere. And, there's a lot to learn in the acute care setting. There's a lot to learn anywhere, but in terms of always apply is the short answer, because there are so many things that I could never say, like if they have had a lot of exposure and had a clinical, if they, there can be so many things. So just apply and reach out and follow up and, show you're involved and you're invested, and write a cover letter, guys. Write a cover letter. That's that's what you should do. And dress professionally for a resume, for your interview, and be on time and use resume paper, says Erin and I. So these are the things that you can do to shine in your interview. So.
Awesome, thank you. We have a new CODA grad who was looking for advice, so that's perfect.
Katie, you want to watch the time? It is after 6. You were about to. No, she was.
I could go on for 8 hours. You got to stop me, guys. Thanks, Darlene.
Okay, well, yeah, I was just wanting now. I guess for students that might have additional questions, rehabilitation area team, can we reach out to you all with some of these questions? So maybe we can even make sure that the students get their answers. It would have to be offline, but is that okay to do that?
Yeah, that's
Absolutely.
Okay. Okay.
Awesome.
Okay.
So students who have extra questions, Karen just put our Darlene and I's email in the chat. Go ahead, email us your questions. We'll compile a list of them and then give them over to the rehab team. And that way we can get back to you with some answers.
Okay. Okay. Well, then in the essence of time, wow, where did the time go? Okay. In the essence of time, let me at least say to everyone on our panelists today, thank you so much. This was extremely informative, and probably based on the number of questions, as I said, the students can probably listen for another couple of hours. So we will make sure that we reach out to you. As Katie mentioned, and thank you, Karen, in marketing, our contact information is on the screen. If you have questions, please reach out to us. We're more than happy to answer those and get your rehabilitation questions, of course, to the team. Also, just before we go, I have 2 quick announcements. We are hiring for a patient safety attendant. There are over 20 positions that are posted at Mary Washington Healthcare as we speak. So if you are interested in a great opportunity to get your foot in the door, please make sure you apply. The website is there on your screen. We would love to get your feedback, and I can share the feedback with the rehab team as well then, but please complete the survey, the program evaluation. The QR code is there, so please give us some feedback so we can make sure that all of our programs are as informative as this one. And then lastly, don't forget, we have another Kahoot game. You can see the code right there. This is called our post Kahoot game. It's all about the rehab careers. I hope you were paying attention. If you are our top winner, one of 3 top winners, we are more than happy to send you one of our, I guess we call it a gift pack, a care pack. We have some great prizes, so I would love for all of you to participate. And with that, rehabilitation team, thank you so much for your time. Katie, thank you, my colleague Katie, and also Karen in marketing, thank you very much. Please have a good night. Thank you so much. Bye-bye, everybody.
Thank you.
Bye.
Bye, thanks again.